Know that they ride or die. I keep waves by my side. CJ Ike, now I gotta roll with ice. Cold, these brothers my guys. Know that they fly, know that they ride or die. I keep waves by my side. CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers my guys. Know that they fly, know that they ride or die. I keep waves by my side. CJ Ike, now I gotta ride or die.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are
ready, go live, go to our pages, YouTube, Facebook, Steve the Kidney Nurse.
Ain't no runners, bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm fucking running.
What's going on? What's going on? Welcome to Steve the Kidney Nurse. Happy Sunday to you. It's been a minute since I've been on. Thank you for joining me. Let me tell you, if you're watching this right now, it's only 3 people watching. But let me tell you something. If you want kidney dialysis, you got a father, mother, sister, brother, parent, anyone on kidney dialysis, you need to share this broadcast and have them watch this show. I'm going live as well on TikTok, and I urge people on TikTok to go to YouTube and Facebook, Steve the Kidney Nurse, if you want to hear the whole conversation of what's going on. It's so many dialysis clinics out there that excuse my language, but how the hell can one nephrologist go around and see hundreds of patients in one day? Okay? You got these guys back in the day before they really started implementing nurse practitioners to work with nephrologists. You had these guys riding around 40, 50, 60 miles a day, going to different hospitals, going to the clinics. I mean, they were just burning themselves thin. And so presto, now we have nurse practitioners, and you have different nurse practitioners that work in different nursing disciplines. Tonight, I've been blessed to meet a beautiful nurse practitioner as well as smart, and that's an Army veteran that's dedicated her career to helping renal patients, not just going into the hospitals and the clinics and walking from here and getting in her vehicle and seeing patients and going home and sitting up with her feet up and whatever the case, but she's actually on social media trying to make a difference, not trying, but making a difference and making an impact. Again, we just need the patients, the parents, the caregivers to come and see the information. The doctors don't know everything, and nowadays, you're going to rarely get a doctor to call you back. It's going to be the nurse practitioner. That's going to be the go-between. I kid you not. So without further ado, I want to bring on my special guest, and I would like to call a colleague in advocacy because, again, she's doing amazing things in Miami, Florida. And Florida is one of the top 10 states that is prevalent with kidney disease, kidney failure. You got Jacksonville. I mean, you got so much going on down there. So let me give my guest the VIP treatment and bring her on, and let's talk about this. Here we go. Hey, Darlena, how you doing?
Hey, how are you?
Pretty good, pretty good. Again, thank you for joining me. And let me just give you the respect of putting your name and title up there because you deserve it. As we talked backstage before you came on, I asked you, how did you get into renal disease as a professional? And so if you can you briefly share how you landed to where you are now as an adult practitioner, registered nurse, family nurse practitioner, and certified nurse nephrology nurse practitioner? How did that start with you?
I originally was supposed to finish up my nursing for my nursing program after I had finished with, just came out of my time with the military, and I ended up getting sick. And the next thing I know, I ended up applying for my LPN instead because I couldn't finish for my RN. And from my LPN, I went straight into the rotation for dialysis. It was the first time they had ever had LPNs in that hospital for dialysis, and I fell in love with it, and I've been in dialysis ever since.
Wow, that's amazing. Now, let me ask you, when you worked in dialysis, have you ever worked as a charge nurse or worked on the floor?
So I worked as regular acute nurse. I worked in floor nursing. I did home dialysis. I was charge nurse. I ran a dialysis facility for 16 years. And then I became a nurse practitioner. Okay. So I've been at every level. So I know how hard it is when you're just being either, an LPN or a PCT. So it helped me when I ran the dialysis facility because I knew what my staff needed and what they went through. And I always, that was my thing is we're all here as a team and we need to do things together. And I'm here today with that.
So let me ask you, what made you decide to transition from actually working with patients on the floor? And like you said, you ran a clinic for 16 years. What made you transition from that to being a family nurse practitioner, and especially working with kidney patients as a family nurse practitioner?
Well, we have, Miami has a lot of nurse practitioners that are in the area. So we had, at this time, this is when nurse practitioners are kind of beginning to come out. And I had a few I had a chance of meeting a nurse practitioner, and she was rounding, and I have been a clinical manager for some time now, was interested in a change. My dream job was always working for this group as a nurse practitioner after finding out what they do. And I decided to go back to school. And it was the best thing I ever did because I got my bachelor's in healthcare administration first. And then from there, I did my master's.
Let me ask you, Darlene, by you now being a nurse practitioner, you pretty much are the go between the patient and the nephrologist. I mean, the nephrologist,
the doctor, yeah. Mm-hmm.
And still sees them. But when did that really start transitioning to be what it is today? Did it, I mean, a couple of years ago, or when?
I think right now you see us a lot more prominent, just because of the patient load that the doctors are having to take on, are needing to see, and they can't, like you said, they can't be there in different places. And with us as nurse practitioners, we mainly are in more contact with the patients. We're rounding, we're seeing them. I still see patients in the office just like the doctor does. I do call, everything. So you have different levels of nephrology nurse practitioners. Some just do dialysis, some do just hospital. So, you have them in all different levels. So it's something that is a necessity now. And you're seeing more and more nurse practitioners in this field, I think. Over the years, I think you've seen a big growth.
Mm-hmm. When you first started in the nephrology as a nurse practitioner, did you start getting a lot of pushback from patients who were so used to seeing their doctors and being real direct with them and comfortable with them, and here it is now, and they see a young lady or a young man come in, nurse practitioner, taking on that role? Did you get much pushback on that?
No, I don't think I did so much because I'm so known down in this area. I've been doing this for 32 years now.
Wow.
So even though I'm a nurse practitioner, and they had never seen me, whatever. I actually have been, I think it's about 9 years now. I'm going to be coming up 9 years with nurse practitioner itself. But mine was a little bit, I think, easier than most nurse practitioners as well because of me already being in the environment. I'm seeing the same patients that I took care of as a nurse. Most of them had met me in some way, shape, or form. And then me knowing that population, I know how to approach the patients. So it was a comfort for me. It wasn't, I didn't feel weird about it. I think because I was a little bit more comfortable, it made the patients very comfortable. I try to be as personable as I can when I speak to the patients. I'm very open and very, down to earth. So I try to make it, I try to make them comfortable when I introduce myself. It's very important, I think, that the patients know that you're there to help them and see them once a week so they get proper care. And that once you explain yourself and who you are, I don't think you get much of a pushback. I think we get more of a pushback maybe in the office, but not so much in the dialysis rounds.
Right. So you mentioned something very important. You said you've been doing this for 32 years. At what point did you start to see that this was becoming a problem? And what I mean by that is it's no stranger that there's a proliferation of kidney treatment centers around the country, mostly near family dollar stores, fast food places. When did you start to really notice that?
Probably when being as a clinical manager, you realize the magnitude of how many patients we have that are on dialysis. Because I go to, at that time I was going to a lot of conferences, meeting a lot of other nurse practitioners, seeing the numbers. When we would go to meetings, is alarming, and it's not getting, it's still a very fast growing population, especially amongst African Americans and Hispanics. It's huge. So that's why I started my Instagram page as a nurse practitioner, because there's not a lot of information out that is regarding renal failure. Most people find out about renal failure once their family member ends up on dialysis, or someone that they know has dialysis, or themselves end up having a problem. But you never hear anyone really talk about it, which is sad, because we have a huge population of patients that have renal failure, and they live amongst us as family members, friends that are, even if they're not on dialysis, they have some form of renal failure and probably don't even know it. So it's something that I'm very passionate about trying to get that word out, because it's a problem.
Mm-hmm. Let me ask you, in your opinion, why do you think it's a problem with the lack of education and getting that out there?
For some odd reason, with renal failure patients, or with patients with chronic kidney disease, I guess because it's so silent, not many people hear about it. They don't hear about it until after, like I said, someone's that they know has it, or have some encounter with it in the hospital, or they got sick. It's something that no one ever knows about until after it occurs. So
Right.
I think because of that reason, there's no emphasis on, this is a problem, we need to fix this. We're already in that snowball that is already a problem, and then there's so many issues with false information out there. That's a whole nother level, because now you have either no information, or the information that's trickling around is not correct. So again, why there's a problem is just, it's hard to get that out there. And a lot of times people don't want to hear about renal failure. So, and that's another subject. They hear that word and they think, okay, I'm going to die if I have renal failure. And that's far from it.
That's the truth. That's very far from it. And that's a misconception. And I think that's where education is needed. Where you practice at, are you the only nurse practitioner that goes into the facility?
No. So in my group, we have hospital nurse practitioners, and then we have the dialysis nurse practitioners, and CKD. So we do a little bit of all. I do mainly outpatient dialysis units, and I go into the hospital when they need me. I'm on call as well. But I'm the main one that covers the entire South End. So I have a big load of patients. I have like 8 or 9 units that I cover.
Wow. You said 8 or 9 units?
Yes, 8 or 9 units.
And what's the largest?
Huh?
What's the largest unit out of those 8 or 9 units?
Oh, I think I have one that has like 128 patients.
Chairs?
No, they have like 26 chairs. I think this is the largest. But they have 3 shifts. I have some of them have 4 shifts. So it just, they're all over. So I have small units, I have big units. I have some of the largest. So.
And that's the thing with, these units, they got these 4 shifts. They're just trying to squeeze everything in a long period of day of, I know patients work and stuff like that, but I've seen places that have 4 shifts. And the thing about it, when you have staff that may have to work those 4 shifts, that's kind of a burnout because at the end of the day, you're tired. And if you got to come back the next day or work somewhere else, PRN, I mean, it could be tiresome. And when you go into work, it's almost like you're taking a risk because you got a patient's life in your hands. And if you're tired, you could kind of make a mistake, not
Well, with
purposely.
well, down in Miami, I don't know how they do it at other areas, but in Miami, the one whoever has that last shift is usually comes in later. It's not the same shift that started the day.
Oh,
So
okay.
so that's never an issue, at least not in my clinics or issue in my area. Our nurses and staff come in after. So they come in a little later that runs that later shift. And for our patients, our nocturnal shifts are usually dedicated to patients that work. So we get a lot of patients that work during the day, so they come in and dialyze late at night.
Mm-hmm. So let me just ask you from your opinion, do you think that renal nurse practitioners are becoming the new faces of kidney care?
I think so because it's needed. We're definitely needed in this population for the fact of being able to provide that one-on-one care. It's important. We know that the more we are interacting with our patients, the more we're there for them, they get better care. They're going to get better care all the way around. They're going to be able to get their medications in a timely manner. They're going to be able to see someone if they have a problem. If something is occurring, they can get it resolved a lot faster because they see their nurse practitioners weekly instead of having to wait and see the doctor once a month. So it's essential that nurse practitioners are there and involved. And I see a lot of patients, but I'm there with them every week. So they know that this day, my nurse practitioner is going to be here because I'm very consistent on the days that I go. And even if I don't go, if they miss me or they were out that day, I'm just a phone call away. And sometimes I actually go back. I'll go back to the units to see them if I didn't see them for some odd reason and they need to see me. So it allows us to have a lot more flexibility with the nurse practitioners being on board.
Mm-hmm. No, Jared, I met Miss Bannis on Instagram. That's where she does a lot of her advocacy on Instagram. So with that being said, um, do you find yourself sometime with the 9 facilities that you see overwhelmed? Do you have a system in place that helps you facilitate to make your job more efficient and
Oh, yeah.
able to give quality care?
Absolutely. So I'm the hyper one of the group. So I have energy for days. So I go in very early. I start very early. I finish very late. But every patient that sees me, no matter what shift I'm on, I have energy. So when I come in, whether you saw me at the beginning of the day or you see me at the end of the day, I always have a smile on my face. I always come in with positive attitude, and I want my patients to feel comfortable with who's taking care of them. So I come in with mad energy, no matter whether it's the beginning of the day or end of the day. It don't matter to me because I'm doing something that I love to do. So, I have a system. I go and see certain patients, units at certain days. And with that, I'm consistent. So the patients and my staff are very comfortable knowing that any minute now at a certain time of the day, I'm going to walk in and be able to take care of them and see them. And I usually am very, always there. So they know if they, that their nurse practitioner is going to be there and I'm there.
Mm-hmm. So let me ask you, Darlene, what if a patient, um, say you come in, you see a patient, and they want to make an adjustment in their in their care, in their treatment plan. Maybe they're monitoring their KT over V. And KT over V is just something that measures how much clearance is being removed. But if they want to talk to you about adjusting their time, they've been keeping up with it, they've been mindful. Um, is that something that you have to go to the doctor to talk? Because we know the doctor has to change the orders, but can they talk to you about stuff like that
Oh yeah.
in their
So usually
time?
oh, absolutely. My patients talk to me like they would talk to the doctor, like the same. Some things I can adjust. I will adjust with them if I feel that, we can do it without them affecting their KT over V. Yeah, we make those adjustments. So I believe that the patient should be involved in every decision that they have, if much as possible. It's important that as a patient, they have that control, at least as much as they can, where we can also provide the proper care. So I always want my patients to tell me if there's something that they feel would make their treatment better or easier for them. And then we try to work something out. Because at the end of the day, I want them to feel okay with coming to treatment, and I want them to be compliant as well. Because if they don't like their treatment that much, or they feel that they don't want to go, they're not going to show up. So it's my job to also listen. And that's important. You have to listen to the patient.
Now, being in the capacity that you have been in, we may be having patients watching this broadcast right now that sees nurse practitioners that may not pretty much care for them because they may not, I don't know, but they feel like they may not be hearing their complaints or listening to what they got to say. Um, what suggestions could you offer to, because you're in Florida, you're one person, and there may be people listening here and like how you deliver your care and spend time with your patients, but what would you suggest to patients watching and they do have to deal with nurse practitioners being that middle person and they don't always see the physicians and they feel like the nurse practitioner is not listening to them, or maybe it's a nurse practitioner that's very new to dialysis? I mean, you have 30 something years working in the industry, opposed to you can get a new nurse practitioner that
Right.
finds a job in a nephrology practice, and they may not understand everything that the patient may go through mentally. So I'm just saying, just in your opinion, what would you suggest to that patient if they fall into that type of situation?
I would say communicate with the person that you're dealing with. Sometimes I think, and that could be whether it's a new nurse or a new doctor, just as well as a new nurse practitioner, they might not be aware of how you feel. Sometimes just sharing how you feel or what you're feeling will bring some attention to what's happening with how that person is maybe delivering their care. Some maybe they're not aware that they don't, that you're feeling that way about the care that they're providing. So I think the first step is at least communicate with that individual what you feel. And that's okay. Is something that needs to be shared, whether you feel that is, useless or not. It's something that I think a lot of times we don't know that people feel uncomfortable. So it helps when someone tells us. And of course, if you go to that nurse practitioner and you explain to them that, you're feeling uncomfortable, go to your nephrologist that has this nurse practitioner on board. Sometimes it helps to go to the physician as well to say, look, I know you have your new nurse practitioner. This is how I'm feeling. Maybe they can give you some clarity of where she is with how much knowledge she has, or what they're doing to make sure that she is doing the proper orders, or looking at your care, or even looking at your labs a certain way. So I think communication is important, whether it's me as a nurse practitioner or the patient as well. We need to speak to each other and communicate with each other so we can all be on the same page, because whether it's a doctor to doctor, a nurse practitioner to or a doctor, or a patient, vice versa, communication is important. If you don't know, it can't be fixed.
So, Darlene, let me ask you, as a nurse practitioner, now, like I said, your role has changed. I mean, you've done so many things throughout your career, working on the floor as an LPN, putting patients on dialysis, taking them off, then becoming a nurse, administering medications. I'm sure you probably participated in many codes. But now, as a nurse practitioner looking at renal care from a different perspective, what challenges do you see now that you didn't see among patients that's happening now? And what I mean by that, like when you see new patients coming in, like, do you see challenge of them adapting to the treatment plan of renal care? Do you see challenges of patients not complying with dietary intake, or taking their medication where they may come in their blood pressure 220 over 110? I mean, what big challenges do you see now that you didn't see? And the challenges that you see, what can be done for patients who may be on the cusp of starting dialysis at maybe stage 5 or stage 4, that's trying to prevent to move forward to the hemodialysis?
I think the challenges that I see probably as a nurse practitioner that I did not see as a nurse is where they start off, the more of the before dialysis. Because in dialysis, I only saw patients once they got on the machine, as a clinical manager. Here, as a nurse practitioner, I see them, from the hospital to seeing me in the office to being on dialysis. So I see all the different levels that they go through. And I think the biggest challenge is still to this day is the knowledge, is how much very little information it is out there to help the patients. And now I'm seeing in this recently, even myself and my colleagues, we're doing more education before they get to even dialysis. So we'll have patients that come in that have a lot more knowledge about what they are to expect. So that's going to help them in the transition. When that time comes from CKD to dialysis, it's going to be very good for the patients as well as the family members that are going to be going through this with them. So I'm excited about that, because we've been, we have had little education before then, and it did its purpose. But now we have better material, so we can talk about every little aspect a lot more for them. So that's going to be good. I'm happy about that.
So that's awesome. Now, darling, let me just ask you, and not talking about the group or practice that you're particular working with, but in your opinion, why do you think um, newly diagnosed patients that are in a hospital that may see a case manager are not really educated about like other treatment options, that like they're kind of steered into outpatient treatment where some of the practitioners may have affiliation with that particular unit? Because and the reason why I asked this, because I've seen patients who worked and they didn't know that they had the option of home dialysis where they went no
From
one,
the hospital out?
huh?
You're saying that from coming from the hospital out?
Exactly, like being in
Okay.
the hospital and being educated right before they being discharged, so they know kind of like how to plan their future. Like, but what I said, it was a gentleman that I met in my career that no one ever told them about home dialysis, not even in the hospital.
Hmm.
And so once he got out, he kind of had to make a decision on his job or dialysis, because they didn't have the the schedule that they can meet his needs so he can continue working. So he had to decrease his work time to eventually he had to stop working because it couldn't meet his treatment demand. And then couple of years later, he found out about home dialysis. And the only reason I know this because a gentleman shared this story on
Wow.
my broadcast.
Okay.
But I see that a lot. But I'm just want to know, in your opinion, what you think. Um, why maybe patients don't get that initial education about the different treatment options. So while they're in the hospital, I know they already bombarded with having kidney failure, but knowing what your options are, be home in the comfort of your own home, have your caregiver, or go into a unit or doing CAPD. That's not really touched on a lot in the hospital. It seems like it's almost like up here, I'm talking about, is that the patient it's emergency dialysis, get the catheter. Now they're ready for discharge, and the case manager want to know what area do they live in so they can find an outpatient treatment center for them.
So to me, I think that reason is because of the abrupt admission. So when one of the problems that we're seeing is a lot of patients don't know that they have renal failure to begin with. So they end up in the hospital abruptly, thinking they have a flu or a cold that just won't go away, and they find that they're in full renal failure. So at that point, now they have to get dialysis. I mean, there's no options. They have to be placed on dialysis, and hemodialysis is what happens. They get a catheter abruptly, and then they start dialysis, and then from there, they're placed into an outpatient clinic. And because of that, you're only in the hospital for a certain amount of time. So your time span of like getting the catheter in, starting you on dialysis, explaining to you what's going on, it's a lot already overwhelming for the patients to gather this information. And at that same time, we have, I don't know down where you are, but we do have that education for our patients. So I also think that might fall depending on who's the nephrologist that's caring for those patients. I mean, we as a group are very proactive on having our patients know the options that they can have. So the only thing I can say about that is maybe it's the way the system is in that particular area you're in, that this is not something that they're implementing as well. I know down in our area we make that an option, and especially home dialysis is a very big thing here where we're trying to, have the patients have that option as well, especially my workers. I'm very good about bringing that up, and I push transplant all the time. So I think that a lot of that is just that abrupt getting admission, being there for such a quick little bit amount of time, and then having to be set up in an outpatient unit, and then they leave it to the outpatient unit to do those education. Sometimes that happens even with us where they get discharged and then they get that other type of options after the fact, after they've gotten settled, and if they're going back to work or not going back to work. But most of the time, at least with our group, we do notify our patients, okay, what are you interested in? But if it's abrupt and they have to have dialysis right away, it's really not a choice. They really have to go on hemodialysis. There's no other option. It's an emergency. You can't do, even if you wanted to go home hemo, depending on if you come into the hospital abruptly, even if we wanted to put a PD catheter in, and we can to start home dialysis, we can't start dialysis by peritoneal. It doesn't provide the same type of removal of toxins that hemodialysis will in an emergency dialysis. So peritoneal, even though it was an option, it's not something that it can get right away. So
No.
I think that's why.
And I understand that because it's emergent, but after the fact, once they got the patient stabilized, maybe some type of education can come in.
Definitely.
Before they get discharged.
Right. And like I said, it depends. I think that falls on, whoever the nephrologist group that is taking care of that patient and the nurses that are tending to them in the hospital, to see if, and making sure that they know what kind of different options that they have that are available to them.
Mm-hmm.
So, and that's one of the reasons with my CKD patients, the patients that are just, when I'm watching them, their kidneys in the office, that education happens before that even goes into place.
Now, you mentioned transplant. How often are your group or practice getting referrals for transplant when it comes to newly diagnosed patients? Are patients, kind of being pretty much complacent with what they're doing in dialysis, or are you seeing an increase of patients wanting to get on the transplant list?
I'm seeing an increase in patients want to get on transplant, maybe because we also have a lot of patients that are getting transplanted in this area. I think I had like 4 or 5 just in the last few weeks or so. So that motivates other patients to say, hey, I want to get a transplant. And I'm really very proactive with that, especially with my younger patients, that, I push for them to have transplant. And our social workers are really good. They have very good communication with, because we have Jackson, Maine. So we have a lot of, good resources there that come out. They actually come into the clinics and talk to the patients about the transplant. So it's a nice setup. I can't hear you.
Darlene,
Okay.
let me ask you, if you had someone watching right now, or someone, you happen, like for instance, you do a lot of advocacy on Instagram, and guys, please follow. What is your Instagram handle, so I can just put it up there?
Is Peaches Banis.
Wait a minute. Let me change this. Peaches.
Yeah, APRN.
APRN.
I do believe, you know what? I think that's it. I think it's Peaches Banis APRN. Or is this Peaches APRN? I have to go check.
That's all right. Let me And
That's
so
it. That's it.
oh, it's APRN, right?
Mm-hmm.
Yeah, I don't know why I keep wanting to put that as. Oh no, that's right. Peaches APR. I got it right. I got it right. Um, so if somebody wanted to reach out to you just for information, would you respond to them?
Oh yeah, I have people that DM me all the time. So if you DM me that on my Instagram, I'll be glad to ask questions. I have other nurses, and sometimes I have people that are patients or family members that have family members that are on dialysis, and they ask questions, or they want a little bit more information about certain things, or even nurses that are interested in going into nephrology as nurse practitioners. I have conversations all the time, so it's very easy to get in contact with me.
Have you ever thought about starting your own practice?
My family keeps telling me I need to start my own practice. I have patients that keep telling me you need to start your own practice. Yeah, I thought about it, but I'm really happy with the group that I'm working with.
Sure.
We have a very good rapport because of the history I have with them. I guess it's like my family. So I guess I'm just happy where I am, and I'm good. I'm all right.
Oh, that's good. That's
I'm all
good. I
right.
mean, I'm sure, being that you are, nurse practitioner, family nurse, practice, that you have a lot of options if
Yes,
it
and we
needs to
do have
come
that
down to
option.
that.
That's one of the options, is going into your own practice. It is.
Yeah. But as I was saying before I went to your Instagram, um, if someone's watching this and they're in one of the stages of kidney disease, and by you being a nurse practitioner, and you try to educate and make sure people who do or may be in one of the 5 stages of kidney disease, we got about 10 more minutes left. Can you just share some what's the word I want to use? Some suggestion, some resources, just some information that can help people uh, not make it down that road to kidney disease. And
Oh
then
yeah.
if they do make it to that road, what they can do to just better the quality of their life in spite of living with kidney disease.
Okay, so renal disease, I always tell my patients, is not the end of the world. It's just part of something that you live with. We have patients that have been on dialysis for over 45 years and they do well. It's about compliance and making sure you take care of yourself. So making sure your blood pressure is very controlled is important. The sugars, making sure your sugar is also well controlled. Diabetes is the number one cause of renal failure, and hypertension is the number two. So imagine if you have both. You need to make sure that your blood pressure is well controlled. It needs to be less than 130/80. Make sure you're compliant with your medication. If your blood pressures are running high, talk to your doctor and make sure that you get the necessary adjustments on your medications, as well as your sugars, making sure you check your sugar twice a day, making sure your sugar is running in a adequate numbers, not 300s, not 200s. It should be between 80 and 120. Your hemoglobin A1C should be 7.0. So you need to just know where you are. If you don't know what your labs are, if you don't know what your kidney function is right now, I think the best place to start is making sure you get those labs done through your primary so you will know where you are. And if you don't, here's the time. Go to your primary, make sure you get your updated labs for annual, and make sure you know where your kidney function is. Knowing where your kidney function is and knowing where you are with how much kidney function you have is a huge, huge deal. So if you don't know, I encourage everyone to always know your numbers. See your primary at least annually so you will get those numbers. And then if those numbers reflect that you have renal failure, which is CK3 through 4 or 5, then you come and see me or another nurse practitioner, nephrologist that can help you stay off of that machine, or at least slow down the progression. And that's important because at the end of the day, if you don't know where you are with your kidney function, you're never, at the last minute, you're going to be forced to be in a hospital and looking to see how did you get here. So knowing where you are with your health, where's your blood pressure, where's your sugar is important.
Wait a minute. Hey, all right. Sorry about that, Darlene.
Okay.
Like I said, I had people on TikTok listen to what you were saying, so I have to unplug my mic in order to do that. But that was some very great information you gave. And are you going to continue to like be on Instagram and do what you're doing? Do you have any plans for that? To do anything more than what you're doing, or what what you're doing now and is like a lot on your plate?
Actually, I'm gonna still be on Instagram. I'm on most of the time I'm on Monday through Friday.
Sure.
Putting up questions, putting up information about renal failure so everybody can get as much education as they can on an ongoing basis. Right now, I'm waiting for, other opportunities that are coming about. Actually, I'm going to be a speaker for 2 different medications that help our dialysis patients in our area. So I'm excited about that. And that's going to be a new venture. And
wow.
And I got some other things coming and brewing that I will announce on Instagram when it comes.
Sure.
But there's a lot going on, and I've got a lot of new things coming about, so I'm excited about that.
Right. And if I could just put a plug in, but also for you coming on, my show, being so gracious to come on, through Instagram, if you could send me maybe, if not your home address, but your work address, I'd just like to send you a signed copy of my book.
Of course, I would love it.
Yeah, how to survive outpatient hemodialysis. And maybe you can have it in your office.
Yes, I would have that for my patients to see. That'd be great.
Yeah, absolutely. Absolutely. Yes. It's just about getting the information out there, because it's not enough, nurses or even doctors just getting the information out there about people trying to, like you say, halt the progression of kidney disease and not make it to one of these units. Because I feel like once you hit the dialysis unit, that's your new normal until really, and it's the truth, until if a transplant or you expire once you get on the machine, and that's unfortunate.
Yeah. And we do have patients that end up on the machine for a short amount of time if they're acute,
exactly.
They recover. So everybody that ends up on dialysis is not on for always for the end of their lives. But I can say that just because you end up on the dialysis machine does not mean your life ends. It's just now something you have that's in addition to that you have to live with. And you still get to travel, you still get to do things or go places. It's just, you just now have to live with it with dialysis. So the best way to to embrace that is say, you know, this is where I am. Continue to travel, continue to see your family, continue to do things that you love, because dialysis is not an end all.
Absolutely, absolutely, guys. And again, we're down to the end of the show, but Darlena, I definitely appreciate you coming on, and would like, you know, as time permits in the future. I know you have a busy schedule. If you can come on again and just maybe have conversations about different things that may go on in dialysis, you know, like certain issues like air embolism or clotting or low blood pressure, stuff like that. But
good.
Again, thank you so much. We got, again, Darlena Banners, APRN, nurse practitioner, family nurse practitioner, and CNNMP. And please follow on Instagram. She has a lot of information. Just very rounded person. So again, thank you for coming on, and I look forward again. If you can send me some type of address and Instagram, and I'll send you a book or two. That maybe one for you and one for maybe a patient that you may see that is getting ready to head toward outpatient dialysis.
That would be great. That would be great. And thank you so much for inviting me. It's been a pleasure. This was very nice.
Oh, it was. Look forward to working with you and seeing your work on Instagram. And again, have a great evening, and I'll talk with you soon.
All right. Thank you so much. Bye, everybody. Thank you.
All right. Thank you, Darlene. Take care.
All right.
All right.
Bye.
So, guys, this was a great show. Again, nurse practitioners, especially renal nurse practitioners, are becoming the new faces of kidney disease. And what I mean by that, meaning kidney care. That's who you're going to see. You're going to see the doctor, that's true. But if you're at dialysis, most of the time you're going to see the nurse practitioner come through, and that's the person you need to trust, right? Because the doctor's got a lot of things going on. I mean, they're going to this hospital, that hospital. They're talking to other doctors. They're doing consults. They're doing office visits. I mean, so much going on to where if you're working with a nurse practitioner and she comes to see you every week or whenever, even though she does have a patient load herself, but us nurses are very personal when it comes to patient care. I mean, because we work right there with them. So thank you guys for watching the show. Again, please follow Darlena Banners. Like I said, her Instagram is Peaches, APRN Instagram. It's almost like having your own nurse practitioner. I mean, she's not going to be there all the time for you. She got her own work to do and cut out for her. But what other nurse practitioner that works in dialysis that's on social media that's giving information out? It may be some. I haven't seen it, but that's why I invited Darlena on here, because she can show a different perspective. Yes, there are nurse practitioners that work in dialysis, but you know, you don't have too many that go outside of their job and do extra, like share information, advocate for patients, go on social media, and do things like this to help other people. So again, thank you guys for watching. Again, her Instagram handle is right on the screen. If you want to reach out to her, see her content, please reach out to her. And so with that being said, guys, I want to thank Jared Brown for watching, everybody else who commented, Frederico, thank you for tuning in. Again, Jared, thank you for the Warriors Quest. We have some people from YouTube watching. I have some guys over here on my TikTok watching as well. Thank you. I'll be talking to you guys after the show. But once again, thank you guys for watching Steve the Kidney Nurse right here on the Urban Health Outreach Media. And with that said, I'm out of here, guys. Have a safe week. Stay safe and peace and blessings. Thank you.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm crossing. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't no gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm fucking running.